Signs of OCD. A lot of people casually use the term OCD. Being neat is OCD, keeping things in order is OCD, and wanting things perfect is OCD. But the truth is, OCD is more complex than that. It's a serious condition that involves a lot of hidden struggle, especially fear and anxiety. What is that fear and anxiety? Let me explain quickly. Actually, our brain is designed to protect us from danger. Think of it like it has a built-in alarm system. When there's a danger, this alarm system switches on to warn us. But when someone has OCD, their alarm system is always on. The brain keeps sending out warnings even when there is no real danger. It's like a constant signal saying something's wrong, over and over again. To turn off the alarm, brain will ask you to do some things. You perform certain actions or rituals repeatedly until the alarm in your brain calms down. This is what we call Obsessive-Compulsive Disorder, OCD. So how can you tell if you have OCD or just normal anxiety? Well, there are certain signs. Sign 1, obsessive thoughts. OCD often starts with obsessive thoughts. When I say thoughts, I don't just mean everyday worries. We are talking about intrusive thoughts, like fears about contamination, constantly thinking that everything you touch is covered in germs or that something bad might happen. These thoughts can even involve disturbing ideas about harming yourself or others. Sign 2, compulsive behaviors. These obsessive thoughts creates a lot of fear and anxiety within you. So you feel compelled to perform actions repeatedly until your brain calms down. Like you wash your hands again and again, or you check the doorknob repeatedly. You feel compelled to perform these actions to ease the anxiety. For instance, if you're afraid of germs on your hands, you become anxious that they'll cause you harm. So you wash your hands repeatedly until that anxiety is relieved. Sign 3, fear of harm. OCD plays on your deepest fears and amplifies them. It exploits the thing you care about and turns them into a source of intense anxiety. For example, if you deeply care about your family's safety, you might check the doors and stuff every night. That's a normal concern. But with OCD, you'll obsess over their safety to the point where you have an uncontrollable compulsion to check the doors and stuff again and again. Sign 4, perfectionism. OCD makes you so anxious that the world feels like an unsafe place. Your brain needs a sense of control in this unsafe world. So you develop an obsessive need for things to be exactly right to avoid triggering intense anxiety. For example, books must be color coordinated or something bad will happen. Or you might spend hours adjusting a picture frame until it feels just right, even though no one else would notice. It's not about being perfect. It's about the fear that something bad might happen if something is not in order. Sign 5, mental rituals. In this case, your brain tells you that if you don't do something internally, something bad will happen. It could be counting, repeating certain words, or going over thoughts repeatedly in your mind. For example, if you don't count to 1,000 perfectly, your car will get into an accident. Or if you don't chant God's name, your day will be bad. When you do that ritual, it will give you temporary relief from anxiety. Sign 6, avoidance. Your brain's warning system is always on, but it's also trying to protect you from overwhelming anxiety. So you start avoiding certain places or situations that trigger your obsessions. Let's say you're afraid of germs. You might avoid touching doorknobs, shaking hands, or even leaving your house to avoid anxiety. But the thing is, instead of helping, avoidance only makes the fear stronger over time. Sign 7, doubt and indecision. OCD makes you question everything. Your brain's anxiety system is excessively active, so you can't trust your own instincts and decisions. Even small decisions can feel impossible because you're afraid of making the wrong choice. For example, imagine you're leaving the house, but you start doubting whether the door is properly locked. You check once, but doubt persists. What if it's not locked? Then you check again and again. A simple act like leaving the house takes 30 minutes. But even after that, you might still worry that something bad might happen if you don't lock it correctly. Having such doubts can paralyze you and affect your daily activity. These are the signs of OCD. But the real takeaway is, OCD isn't just about physical actions or mental rituals. There's an obsessive fear and anxiety behind it. If you're experiencing these symptoms and they're affecting your life, you need professional help, because OCD gets worse with time. It's a serious condition that can take over your life if not addressed properly. If you think you might have OCD, getting a proper diagnosis is the first step. Thank you for watching.